yesterday around 5 o'clock. This bill was drafted behind closed doors. There was no Republican input, and it really didn't have any transparency until yesterday at 5 o'clock, despite the promises that we have heard that government would be more transparent in this new administration. The 2,000-page bill released yesterday is expected to have a vote to proceed to it within the next 2 days. The bill is 354,654 words. To put it in perspective, the Bill of Rights is stated in 463 words. Lincoln's Gettysburg Address contained 266 words. The Ten Commandments is 297 words. This is over 350,000 words. Why don't we have time to read this bill, digest it, allow our amendments to be put in the bill language? Because clearly, Mr. President, this bill will need amendments. The health care of our citizens is maybe the most personal of all things to every person and every family. We are a democracy, and the American people have a right to be heard on all issues, but especially on this type of issue. We should be given the opportunity to read and hear what is in this bill, to hear it discussed, to hear from our constituents, because it ought to be on the internet. That's why we have the internet access to bills that are introduced in the Senate. But by the time our constituents have a chance to read it, we've already had a vote on whether to proceed to the bill. Even after a cursory review, I know that this bill includes changes that are disastrous to our families, our health care providers, and our economy. Higher taxes, mandates, especially for small business people, penalties, cuts to Medicare, higher premiums, restricted choices, a government plan, and the list goes on. The bill includes almost $1 trillion in taxes, including a new Medicare payroll tax, $8 billion in taxes to individuals who don't buy coverage, $149 billion in taxes on employers who don't offer the right percentage of coverage to employees, $102 billion in taxes on insurance plans, pharmaceutical companies, and medical device companies, which study after study have shown will be passed on to the people who get these services and equipment. To make matters worse, the bill includes almost $1 trillion in cuts to Medicare. It will guarantee to reduce choices and coverage for seniors. In my home state of Texas, 400,000 people love their Medicare Advantage, or at least they have it and they're satisfied. They will lose Medicare Advantage under this bill. The Democrats are touting the cost of the bill as meeting the president's goal of being under $1 trillion because CBO scored it at $849 billion. But, Mr. President, this is a budgetary sleight of hand, because what is actually being scored is the years 2010 to 2019. But the actual spending in this bill won't take effect until 2014. So they are taking the 10 years with 4 years where the bill is not spending anything. So if you score it for the 10 years following when it actually comes into being, 2014 to 2023, the bill costs $2.5 trillion, not $849 billion. Given more time to analyze this bill, who knows what else we would discover. If the Democrats think this is the reform Americans wanted, why rush the bill through the Senate? Why rush it through before we have the ability to review details? The right approach is available. My colleagues and I have proposed common sense and fiscally responsible ways to improve affordable access to health care. We need to do that. We have never said we don't need reform. What we have said is we need reform, that will give more affordable access for coverage to Americans who do not have that access today. We should reassess the goals of health care reform and implement policies that we know will reduce costs. For sure, reducing frivolous lawsuits. Study after study has shown the benefits of medical malpractice reform. In my state of Texas, we have tort reform. We have seen a dramatic increase in physicians who are willing to practice medicine. It has lowered the cost of medical malpractice premiums, and doctors have been able to do their work with their patients with much more freedom, knowing they do not need to order unnecessary tests just to cover themselves in case they get sued. But the majority insists on rejecting this suggestion that we have medical malpractice reform in the bill, and yet there's probably not anything that will save as much money as medical malpractice reform that puts common sense in place for frivolous lawsuits, or lawsuits at all. I will offer an amendment, or at least prepare one, and hope to be able to offer it, that would cap damages, reduce malpractice premiums, and encourage doctors to practice in medically underserved areas. So many of our underserved areas, especially rural areas, have no doctors. There are counties in Texas that don't have a doctor within hundreds of miles, and several counties. That is because the medical malpractice premiums are so high, they cannot afford to do it. The small business premiums are going to go up if this bill is passed. Small businesses already have such a hard time offering coverage to their employees. Why would we make the problem worse? And especially when we have the highest unemployment in this country for the last 40 years. We should be allowing small businesses to pool together and buy plans. We have championed that proposal for years in this Senate, but we have never been able to get over the hurdles to pass a small business health plan. If we could do that, we could spread the risk. The bigger risk pools would produce lower premiums and allow more small businesses to have access to and offer to their employees affordable health care coverage. Allowing businesses to pool doesn't cost the government anything, and therefore would not require tax increases as we see in the bill before us. The Democrats are trying to address the problem of unaffordable insurance by offering credits to small businesses to offset the cost of premiums. But the credits only last for 2 years. So that is hardly anything that is going to encourage businesses to take on the added cost when the credit lasts for 2 years. I will be preparing amendments that at least double that to 4 years, expand the eligibility and duration of these credits so that we can really help our small business people. But even 4 years is not enough. We should offer credits all the way through if that's what we are trying to ask the small businesses to do. Offering tax incentives. There are small businesses and individuals in this country who have no access to affordable coverage. Why not give every individual who purchases their own health insurance the same tax break that a corporation gets for offering health care coverage to their employees? Employees who receive insurance through their place of employment do not pay taxes on the premiums they spend for insurance. Why should individuals who purchase their own health care coverage be treated differently? I have a bill with Senator DeMint that will help provide insurance for more Americans through tax credits and competition. Our approach would be a tax credit for every individual, $2,000 per year, and for families, $5,000 per year for their purchase of health insurance. This would allow individuals to purchase their policies and own them, so they would not have to be affected by what their employee offers or if they change jobs. This is the kind of reform that could make a difference. creating a transparent marketplace online for consumers to go in and shop and hopefully have bigger risk pools, more competition, bringing the cost down. But it's not the kind of marketplace that is in this bill. This exchange has so many mandates on the plans that, like the Massachusetts exchange, it would raise the cost of premiums and would not help in any way bring the cost down so that premiums are more affordable. These are the ideas that would improve competition in the marketplace. I can tell you from the input I have gotten from my constituents since the bills have been out of committee before the bill came to the floor, or is on its way to the floor yesterday, because there were two committees that wrote bills that were put together and released yesterday. I've listened to what people say, and I can tell you they don't want Medicare cuts. They don't want more taxes. Small businesses certainly don't want more mandates, and they don't want government-run insurance, because they know that a government plan is eventually going to crowd out the private insurance companies' plans throughout this country. There is no way that anyone with a straight face can say that the government option will be more expensive than the private options. There is no way that that is on its face possible. So I'm going to be preparing an amendment that will allow states to opt out without penalties, not just of the government insurance plan, but of all the harmful measures. Because why would we have a government opt-out by states if they're going to still have to pay the higher taxes, if they're going to have to pay higher premiums to pay for the other states that have the plan? States should not be forced to participate in the government plan, nor subsidize and pay for such a plan through increased taxes. I will prepare amendments that will exempt individuals and employers from the mandate to buy insurance if this bill causes premiums to rise above their currently projected values. The solution to health care issues is not to give more power to the government. The solution is to give more power to the American people. They deserve a system that assures that America will have the best health care in the world. Which brings me to the new government task force that came out this week that is causing confusion at best and outrage at worst, and that is the guidelines regarding screening for breast cancer. Breast cancer is the second leading death of women in this country. Whether and when to screen for breast cancer has been debated for decades. In 1993, the Clinton administration proposed the government takeover of health care. In that proposal that was put forward by the Clinton administration, there would be no payment for mammograms for women under the age of 50. And after the age of 50, there would be payment in the government plan for a mammogram every 2 years. Exactly what has just been recommended by the federal task force. Now, since we have had the guidelines, which have been in place for many, many years, death rates from breast cancer have been declining. Since 1990, there are larger decreases seen in women younger than 50. The American Cancer Society states that these decreases are believed to be the result of early detection and increased awareness. The evidence has repeatedly shown that screening and early detection saves lives. Unbelievably, the United States Preventive Services Task Force has recommended against routine mammograms for women under 50, saying it is not worth subjecting some patients to unnecessary biopsies, radiation, and stress. The task force also recommended against teaching women to do regular self-exams. You have to ask the question, why this change And why now? Nothing substantial in the clinical evidence that the panel decided to review in the data was there that was a substantive change except spending, cost. Nearly everyone realizes that fewer screenings mean insurance plans, including a government-run plan, will save money. Mr. President, this is how rationing begins. I hope America wakes up. This is how rationing begins. In an article by the Wall Street Journal today, they even recognize that. It says, every Democratic version of Obamacare makes this task force an arbiter of the benefits that private insurers will be required to cover as they are converted into government contractors. What are now merely recommendations will become de facto rules. And under national health care, these kinds of cost analyses will inevitably become more common as government decides where finite tax dollars are allowed to go. That is a quote from the Wall Street Journal today. The American Cancer Society came out after this incredible recommendation and said, with its new recommendations, the task force is essentially telling women that mammography at age 40 to 49 saves lives, just not enough of them. So if the screening is going to save your life, or your mother's, or your sister's, or your wife's, would that screening be worth it, Mr. President? Decisions about care must be between a doctor and a patient, not a doctor that has a loyalty to anyone but the patient, not a doctor that is working for the government and having to maintain government task force guidelines like the one that we've just seen. That, Mr. President, is the crux of the debate on this health care bill that has been released in the last 15 hours. I am so worried that we are now beginning to see the handwriting on the wall. You know, the president said once, there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse. It turns out there is a reason: cost. Now, the insurance companies have sort of said in the last day or so that they're not going to stop coverage of mammograms of women starting at the age of 40. But when the government plan comes into effect, you know that every insurance company is going to say, if I'm going to be competitive, I must adhere to these same standards as the government plan. It's going to happen, Mr. President. It's going to happen. Mr. President, we must have time to look at this bill. We must have time to look at what is happening to the choices, to the health care, to Medicare, the cuts in services, the taxes, the mandates are going to overhaul the health care of our country. And Mr. President, we must have time to look at this bill before we have a motion to proceed. We must have time to study it. We must let our constituents see it because they will catch things that they care about and they will inform us, and that is why we are here. So, Mr. President, I am very concerned that we are pushing too fast on something that we should be taking slow and carefully to assure that we are not going to do something that we are not sure is right and where we have the chance to change what we see is wrong. Thank you, Mr. President.
Mr. President.
Senator from Arizona.
Mr. President, I want to compliment the Senator for Texas for sounding this warning. Being from Texas, she's undoubtedly aware of a great country western song out right now by Brad Paisley called Welcome to the Future. And I think that we've seen a glimpse of the future under Obamacare here by this pronouncement of the United States Preventative Services Task Force, recommending against routine screening of women between 40 and 49 for breast cancer. I just wanted to speak about 60 seconds about this to go into the actual numbers for the study that Senator Hutchison referred to. The rationale of the study is that you would need to screen 1,339 women in their 50s to save one life, so screening is worthwhile. But since you would need to screen 565 additional women, in other words, 1,904 to be precise, in their 40s to save one life, screening is not worthwhile. That's the kind of cost-benefit analysis that will result in rationing. And it's precisely Senator Hutchison's point that this is how rationing begins. Welcome to the future.
If the gentleman will yield, I appreciate his giving us the statistics because one life out of 1,904 to be saved, but the choice is not going to be yours. It's going to be someone else that has never met you, that does not know your family history. And, Mr. President, that was in the Clinton government reform takeover of health care in 1993, and it was soundly rejected. It was soundly rejected. And it was part of the reason that it was soundly rejected, that this mammogram rationing before the age of 50, because we had hearings on this, and every woman in the Senate at the time rejected that plan, rejected keeping women under the age of 50 from having mammograms paid for by insurance plans. So, Mr. President, I thank the senator from Arizona for connecting this and showing the statistics, because this is not the American way of looking at our health care coverage. It is not the American way, Mr. President, and we must stop this government takeover of our health care. Thank you, Mr. President, and I yield the floor.
Mr. Chairman?
The senator from Hawaii.
Yeah. Mr. Chairman, can you tell me how much time I have remaining?
The remaining on your side, 31 minutes and 33 seconds. On the other side, 42 minutes, 15.